Still reeling from the first wave of coronavirus, care homes fear the elderly are being sacrificed once more. Sky News can reveal plans to set up COVID units within existing care homes, which multiple providers have described as reckless and an attempt to keep care home residents out of hospitals. We've obtained a copy of an email sent to care homes in County Durham. It says, "We are inviting expressions of interest from care homes who are able to offer block-booked beds for service users who test positive for COVID-19 over the winter period. This will apply to both service users who are discharged from hospital, as well as potentially service users within the community who require 24-hour care to avoid hospital admittance."
We're also now working with CQC on actually actively inspecting and designating specific facilities.
The Care Minister, Helen Waitley, giving evidence to a Commons Select Committee, said specific facilities would be set up for COVID-positive patients. But Care England says it believes throughout the country only a handful of care homes will be able to set up entirely separate units, prompting serious concerns about the spread of the virus.
It was completely ridiculous for a scheme to be announced at the centre and then for it to be left to the vagaries of 300 and odd local authorities. The bottom line is that we are in the middle of a major health emergency, and what we need is strong direction and clear leadership from the centre.
The government says its absolute priority is to prevent infections in care homes, but providers know only too well of the dangers of the disease. In County Durham, providers have been told the dedicated unit should be self-contained with access as separate as possible. It is also preferable if, where feasible, dedicated kitchen areas and bathroom facilities can be provided. But care homes we've spoken to say the separation of all COVID and non-COVID facilities should be mandatory.
I'm worried about what they're going to bend to get the ends they want. We can't mix populations, we can't put our current residents at risk. Unless the unit is physically removed from the original or existing building, if it's a part of that same building, I don't think it makes a difference, because the virus is too clever and too good at getting around. There should be a separate facility, a so-called hot home, which is just for the care of the COVID positive. Think of it as a Nightingale nursing home.
Paul Sexton says he wants to speak out on behalf of those with loved ones in care homes. His mother, Kathleen, was 84 when she died of coronavirus in a care home in County Durham in May. Angry about government guidelines at the start of the pandemic, which saw untested COVID patients discharged to care homes, he believes the winter strategy is flawed.
It just doesn't stack up. Why would you put a virus in a care home? Wave 2 is coming, well, it's here, and we're doing exactly the same as Wave 1. We know we can't contain the virus, and are people going to die necessarily again? It is chilling. It really is chilling.
Providers are asking why facilities like the Nightingale hospitals can't be used to help care for the elderly. The Department of Health and Social Care says it's working with the Care Quality Commission to ensure care homes which take COVID-positive patients can provide safe care. Lisa Holland, Sky News.